Well, Indiana has historically had one of the worst infant mortality rates in the country, but the state is making progress. In 2019, Indiana saw its largest drop in infant mortality in 6 years. A nonprofit health plan in the Hoosier State is now investing in a program to help Indiana make even more progress. And Business of Health reporter KYLIE VELETA has more. KYLIE.
Well, thank you, Gary. CareSource is a multi-state nonprofit health plan with about 200,000 members statewide. It's one of the nation's largest Medicaid managed care plans. CareSource recently announced a joint program with Goodwill of Central and Southern Indiana's Nurse Family Partnership. The goal is to help some of the highest risk moms deliver healthy babies. Joining me now to tell us more about the effort is Steve Smitherman, the president of CareSource Indiana. Steve, thanks for being on the show today.
Thanks for having me.
All right, well, tell us, first of all, what is CareSource doing? How are they joining forces with Goodwill to focus on moms and babies here in the Hoosier State?
Yeah, so we are providing the funding for nurse family partnerships to bring on additional nurses to provide care for these families, particularly in 9 counties in southeast Indiana. And we really focus on that area of the state because that's the area of the state that has the least resources available to pregnant moms. So we're hoping through this partnership we can make a significant impact in that area.
So I understand CareSource is providing $100,000 to help provide a nurse, and this nurse has started last month. Explain what this nurse means, sort of the day in, day out. What is that experience like to have the nurse for the mother and baby?
Yeah, so the nurse will work with moms during and after their pregnancy to provide medical, parenting, and family education. It's really a real-time resource for the moms to be able to reach out to anytime should they have questions or concerns, and also to ensure that the nurse will ensure that mom is getting all the necessary visits pre and post-delivery for not only herself, but also the baby.
And one of the great things about this is that these are home visits, correct? The mom doesn't even need to leave her house?
Correct. The nurses will be going into the homes of the members to provide these services. So it's nice. The members will not have to worry about transportation or other elements that this way we will ensure that the mom's getting all the visits that they need prior to delivery.
And we were estimating that this will impact about 25 moms total, even though it's just one nurse. CareSource could have partnered with a variety of programs. Why did CareSource choose Goodwill, this program at Goodwill, to be its partner in particular?
Well, I think, first of all, the infant mortality rate in Indiana has been a concern for a long time. We have one of the highest infant mortality rates in the country and the highest in the Midwest. And I know the governor's initiative around reducing that and becoming the best in the Midwest by the end of his term is something we wanted to align ourselves to. And so what we've seen from previous experience in nurse family partnerships is great outcomes from the members that they work with. 89% of the members are born at normal birth weight. 95% of the members are born full term. And then if you look at historically out past 10, 20 years after individuals have been in this program, we see higher graduation rates, lower incarceration rates, just tremendous outcomes for this program. And that's why, we're very intentional of where we invest our dollars, somewhere that we can see and measure the impact that it's making. And we feel like this program is one of those things.
So CareSource covers multiple states, and this is the first state, Indiana, where CareSource is launching this program, so it's a pilot program. What results are you hoping to see, and what do you think that could mean for the future of the partnership?
Yeah, this is a pilot, and if we see the results that we expect or are hoping to see, we will look to expand upon this pilot in future years. And really what we're looking at is to help reduce the infant mortality rates in the area that our nurses will be working. In addition, also to see the impact they may have around NICU cases. The birth weight and the full term is great data that they have. Also around breastfeeding, 93% of their members initiate breastfeeding. We see about 60% less ER utilization for these members. And the great thing is, these nurses will stay with the mom 2 years post-delivery to ensure that these children are getting all of their well-child visits completed as well.
So do you think this could expand throughout the entire state or even be sort of a model for other states that CareSource works with?
Absolutely. I can see us expanding into other parts of the state, as well as expanding this into our other markets if it's as successful as we expect it to be.
So the infant mortality rate in Indiana has dropped for 3 consecutive years. However, we're still well above the national average. You mentioned off camera, this is just one way that CareSource is trying to impact infant mortality. What are some of the other efforts that you have underway?
Yeah, at CareSource, we have a dedicated maternal child team that works closely with moms and babies. We go around the state and provide what we call baby fairs, which would be similar to a baby shower, where we bring in our pregnant moms or moms that have recently delivered and do a lot of education around, parenting, medical, family education is involved in that as well. So that team is very ingrained in the community. They touch all areas of the state. Prior to COVID, we were held in person on a regular basis. We're doing more virtually right now, but post-COVID, we will definitely be getting out in the community again. And we also do a lot of work with the local hospitals and their NICUs, making sure that the NICU babies are transitioning into their homes safely. And one of the things we're doing around that is we're providing baby scales. So we're providing baby scales to the moms of the babies that are being released from NICU that they can have at home. This serves multi-purposes. One, it prevents mom and baby from having to get out and go to the doctor just for a weight check. 2, it provides mom with, a peace of mind that anytime she's concerned about the baby weight, she will have a scale in her home where she can weigh the baby. So we think this is just another way that we can help contribute to reducing the infant mortality rates across the state of Indiana.
Okay, well, Steve, thanks for being on the show and telling us about it. Good luck with the program.
Thank you so much.
Gary, back to you.